My name's Brian Quichocho, and I'm an HVAC technician. I was heading down from the rooftop and I slipped, but I squatted down because I had so much weight. I basically squatted pretty far down. Wow. I drove off. And about an hour later, that's when I started feeling the back pain, the knee pain. It's a sharp back pain, yeah. So from there on, I went to GMH and got it checked. Nothing broken, but it was just a disc herniation. From there, I had a surgery for that. That one was okay for about a year. I was okay, and then after that, I started feeling the pain again. But it's much more worse now. Basically, it just come out of nowhere, and I'll just stay for several hours. It'll just come and go. But for the most part, it comes and it stays for a long while. I went back to my primary doctor and spoke to him about it. So he referred me to come and see Dr. Dulebohn.
So Brian is a very pleasant fellow who had had previous spine surgery that had not gone particularly well. He was left with chronic back pain and chronic leg pain that really could not be relieved by injections or physical therapy. And so we then thought that he would be eligible to be a stimulator patient.
When I first met with Dr. Dulebohn, he sent me to go get a physical therapy for a couple months, and I think it didn't work. That's when we discussed about the spinal cord stimulator.
A neural stimulator is a device similar to a pacemaker if surgically implanted under the skin, typically in your abdomen or upper buttocks. The neural stimulator delivers mild electrical impulses to an area near your spine. The electrical impulses travel from the device to your spine over thin insulated medical wires called leads. Neurostimulation, in a way, outsmarts your pain. The signals from the neural stimulator reach your brain before the pain signal can arrive.
So basically, it provides a stimulation along my spine because they inserted both leads, both in each spine, each side of the spine. So it provides that stimulation to where it blocks the pain. I didn't believe it, but I was like, man, it's working. So we ended up doing the permanent. The only pain I was feeling was from the surgery itself, the cutting of my back and the placement of the device when they implanted it. That's the only pain I was feeling. Because before it was like a certain position where I'll kind of twist my back and I'll just open up that pain again. But talking to Dr. Dulebohn, I knew already I was in good hands when we're discussing about the electronics. Since then, the nurse on the recovering side, she was very nice too, and she took care of me as well. Very accommodating. My name is Brian. I am now pain-free with GRMC.